First of all, when you made that change, raise your hand if you wrote out a specific plan and broke it down into very small steps. Raise your hand. Okay? Did a major life event or an epiphany or a breakthrough lead to the change that you made? Would you raise your hand? Okay? Did you change because your environment either required that you change or just made it really easy for you to make the change? Raise your hand. Okay? Did you change just because it felt good and you just did it without a lot of plotting, without a great epiphany, and without huge environmental redesign? How many of you did it that way? Okay. So I think this is really curious because when we design for change, where do we spend most of the time and effort? When you change, you don't do it that way. Okay? When you change, you don't necessarily write out your plan and break it down into small, specific steps and so on. So there's a whole lot of change going on related to health, and there are many pathways to change. So first of all, my favorite way to change is pleasurable change. And that is, we evolved over millions of years to seek out certain things that are pleasurable, avoid other things because they were potentially toxic. And in seeking out things that were pleasurable, they were often good in terms of improving or promoting our health. And they were intrinsically rewarding, reinforcing, and we just did them and continued often to do them. Second is breakthrough change. And I want to say, I think this is the type of change we understand the least about. We all have known, either in ourselves, our families, or patients that we work with, they'll hit a life crisis, they'll hit bottom, they'll have the major heart attack, something. And suddenly, without a lot of plotting, planning, they change massive things in their lives. Similarly, it can be a positive experience. I walked in to see a patient. He was sitting there, he had a smile on his face. Everything was different. I don't know. He was exercising. He had changed his diet. And so I said, you know, it's not like we hadn't tried to do these things together. I said, what's your secret? And he smiled and he said, I fell in love. I want to bottle that. I want to put it in the pharmacies. I want it on the formulary. Because the breakthrough can come from very positive experience. The birth of a child, for example, pregnancy, often leads to a lot of changes. And those changes are often breakthrough changes. Then there's environmental change. And I want to recommend to you a book, Switch. How many of you have read Switch by the Heath brothers? Highly recommend it. I knew a lot of the stuff in Switch, but what I loved is there's a whole stream of behavior change in there, which is about clearing the path, making the change easier, changing the environment to support the change. And I want to say that this is an extraordinarily important thing for us to do because we are constantly taking our cues from the not only physical environment, but the social environment, what we consider normative. When it becomes normative to do instant recess, you just do it because that's part of the culture. That's part of the way we behave. And then finally, there's incremental behavior change, right? That's the baby steps, small steps, simple steps, tiny steps, starter steps, success steps. That's the one you use least, but that's the one we're going to concentrate on. Because some of the, a lot of our effort still goes into helping set people up for success experiences by breaking down big changes into very small changes.